cutting-edge research is already underway at prestigious medical centers throughout the United States. 1 in every 6 preschool children has unsafe levels of lead in their blood.
30 seconds? Okay.
In this laboratory, with the support of the Environmental Health Foundation, we are conducting research to explore differences in individual susceptibility to environmental toxins. We're focusing on lead. We're finding that different individuals with different genetic compositions are markedly dissimilar from each other in their susceptibility to lead, and that this dissimilarity can lead to very striking variation in the degree of injury that lead produces in the nervous system.
Each year, indoor air pollution costs America $1.5 billion in medical bills and tens of billions in lost productivity.
In this project, we were interested in trying to identify ways to study human beings who have problems from low levels of chemicals in the environment and indoor air, such as the kinds of individuals that might experience sick building syndrome. In sick building syndrome, people experience problems with mucous membrane irritation, with problems with their concentration and sometimes memory abilities. As you mentioned, we are studying real people who we recruited from the community, people who are working out there, who feel that they have difficulties with indoor air problems. We're obviously very grateful that the Environmental Health Foundation funded this groundbreaking research.
This is not a responsibility of scientists alone, or government alone, or industry. They all need to be there, but equally important, the public needs to participate.
We can fight environmental disease without compromising our industrial backbone. The key lies in laboratories across America. Not only can we improve our quality of life, but we can benefit our economy by reducing absenteeism and healthcare costs and increasing productivity and profits. It's a win-win situation for all of us.
Time and again throughout our history, we as a nation have united to overcome the impossible. Together we've seen eradication of diseases like polio. People fish again in waters once thought to be dead. Cities once cloaked in soot now proudly display clean skylines. And if that isn't enough, man landed on the moon. Today the call goes out again to unite to battle this silent epidemic.
The notion of actually forming a private-public partnership and actually creating public awareness of environmental health as a problem, there has never been anything quite like it.
3 to 4 different.
This is the only organization that I knew that is working at the grassroots level to involve the public in all the issues related to exposure to environmental chemicals, educating the public, helping support research activities to address important questions in environmental health sciences.
Environmental Health Foundation will be an important new colleague in the effort to not only identify the important areas of environmental health risk, but to help set an agenda for funding and for education and for influence.
We can bring down human suffering. And when I talk about numbers, 10%, 101.25 million cases, these aren't just bland numbers. We're talking about real people, mothers and fathers and sons and daughters and grandparents who are not living a healthy, normal life. And I want to have this partnership, the Environmental Health Foundation and the National Institute of Environmental Health Sciences.
Children cannot choose their environment. We place them in an environment. We adults place them in an environment. And so that we have almost a sacred duty to them to say, we will provide for you, my child, a safe environment.
We can win the war against environmental diseases, but we can't succeed without your help. The time to act is now. Give generously to support vitally needed research to find treatments and breakthrough cures. Your contribution is tax deductible. Give your time and talent by volunteering for your local chapter prevention programs. We all need to join this fight and truly make a difference.
The way I see it, we all drink the same water, breathe the same air, and eat the same food. We all share the same home with no environmental borders. It's a beautiful home, this place we call Earth, and together we can now make it a better place for us all and create a healthier future for our children.